Hello and welcome to the student evaluation. The purpose of this module is to assist you with the basic principles of providing both a formative and summative clinical evaluation. Additionally, that you will have an understanding of both the process and the importance of how to complete the evaluation with a nursing student. After reflecting upon the information in this module, choose a strategy for keeping track of student progress. Then consider taking the opportunity to prepare with your mentor's guidance a summative evaluation using the evaluative tool for your particular clinical evaluation. Also, consider role-playing the delivery of a student evaluation, especially if you think you will have a difficult evaluation to present. At a minimum, use the guidance of your mentor to talk your way through the evaluation. Please think about the reflection questions and jot down your thoughts in your reflection log, then have a discussion with your mentor. Also, pull out your I will log and jot down some thoughts on the things that you know you will definitely do regarding the student evaluation. Here are the questions for your consideration as you review the module. What values, attitudes, beliefs, or biases do you have that may influence your ability to administer a fair student evaluation? What concerns do you have in judging a student's clinical performance? How do you think you will handle a student that is failing? What methods do you think you will use to remember the observations made of each student in order to perform the formative and summative evaluation? Will you use narrative, anecdotal, checklists, or a rating scale? And what about due process concerns? Here are your suggested readings for this module. You will need to request or obtain these articles from the library. Chapter 15 in Gaberson discusses the student evaluation in detail, and I'll be discussing some of their suggestions in just a few moments. I was able to provide a link for each of the supplemental articles. However, I could only obtain free access to the abstract of Osensky's article, which discusses due process rights of nursing students. I'll talk about the main points of this article near the end of this presentation. Most of these articles discuss the issue of student failure along with strategies for working with borderline students. I highly recommend reviewing the article about failure to fail in nursing programs. I'll briefly discuss this concern in the second video of the module. The underpinning NLN core competency for this module is number 3. It specifically addresses the use of assessment and evaluation strategies. In clinical practice, it is essential for the clinical instructor to provide timely, constructive, and thoughtful feedback to the student and to use this feedback to enhance the teaching and learning process. Let's talk about the importance of documentation. It is extremely important that we do a really good job with our documentation. We need to communicate our documentation with the student regarding their progress and performance. Student performance documentation is just as important as documentation is in patient care. We need to follow the same principles. In the case of a student who may be failing the rotation, our documentation needs to support our evaluation. Our documentation is important whether the student's evaluation is positive or negative. We would like to think we are being objective when evaluating a student's clinical performance. However, in reality, when we are making judgments about a student's behavior, it is subjective. The important takeaway here is that the evaluation needs to be based upon specific predetermined outcomes or competencies. Ideally, I recommend that you go over the specific evaluation with the students at the beginning of each rotation. Now the student and the instructor can better understand the expectations. Gaberson reminds us that we need to be aware of our own values, beliefs, and biases to ensure that we are as fair in our assessment as possible. I challenge you to consider your own personal values, beliefs, and biases. We all have them. And here's one of my challenges. It's the quiet student. I seem to zero in on that student. I tend to attempt to draw that student out. However, I need to remember that just because a student is quiet and doesn't initiate discussion does not mean that they're not thinking. I feel like I need to reach out to these particular students, giving them an opportunity to talk. I use this example because this is something that I saw in nearly every clinical rotation. I probably pick up on this because that's how I was as a student. I was very quiet and shy. And here's my belief. Being shy isn't okay because our patients are counting on us to be their advocates. Therefore, if a student is too afraid to speak up, they might miss the opportunity to speak up on behalf of their patients. I like to work with shy and quiet students, encouraging them to open up on behalf of their patients. However, not to evaluate them unfairly because of this personal bias. Here are the basics for providing feedback to students. Be precise and specific. We need to give the students specific areas that need to be addressed, not general statements like, oh, you're doing a good job, or you need to do a better job with. This is too general. Maybe an example would be you observe the students perform a patient assessment. Your feedback to the student is, I notice you only listened for about 15 seconds when counting the patient's apical pulse. Let the students correct you if this is not correct. Then you have a discussion regarding the apical pulse, that it must be assessed for a full 60 seconds, as well as the other criteria based on the patient's condition. Provide verbal and visual feedback, or in writing. If the student needs to work on a specific skill, then they can be directed back to the skills lab with a specific plan in writing. I want to encourage you and remind you that it is perfectly acceptable and actually preferred that you go ahead and request that the student go back to the skills lab and review that skill with the skills instructor. However, follow the procedures of the School of Nursing. Feedback needs to be prompt or as soon as possible after the skill is performed. The feedback becomes less effective when more time has elapsed, so don't wait to the next clinical day to discuss an issue with a student. Each student, depending on their level in the program as well as the particular rotation, will require a different amount of feedback. And finally, the feedback needs to be a guide to help them improve and to become competent. As instructors, we need to gather the data. It is really easy to forget our observations without a strategy. It becomes very difficult to complete the evaluation without supporting documentation. Some useful strategies are observations, students writing, and discussions. Observation is a strategy that we use all the time. This goes beyond observing a particular procedure. We are also observing student behavior as they are going through their clinical day. And it's really helpful to make daily notes. Remember, whenever you write anything about a student, you should let the student know what you have written. Personally, I have used a reflective tool found in the clinical toolbox. I would review what the student had written and then make additional comments to them in writing or verbally. So I'm using a combination of observation and student writing. This works very well because I now have a written documentation of the student's activities with comments from both of us. I think another strategy that could be helpful would be to write a SOAP note style of daily note, and this is very useful when you're doing a daily evaluation. Care plans or concept maps are examples of student writing as well as reflective journaling. These are great places to be able to see how the student is progressing and thinking. Requiring a student to keep a journal folder either online or a physical notebook where these documents are maintained can really help you to be able to go through and do the evaluation. Requiring the student to keep it together for you provides an organized place to review with them their progress. Additionally, you have a great place to give them feedback verbally and in writing. You can also match specific observations to the outcomes. Post-conference discussions are another great way to hear what the student is thinking. You can hear the way they reason through patient care information and their observations. You can intervene if you have a concern about their critical thinking or clinical reasoning. If there is a particular issue that you are very concerned about, then it is important to meet with a student in private. Now there's no perception that you are belittling them in front of any of their classmates. A student evaluation should always be conducted in private unless you feel it would be more appropriate to have another faculty member present, but certainly no other student should be present. A formative evaluation gives a student feedback about their progress in order to help them gain the necessary skills and outcomes to pass the rotation. whereas a summative evaluation is to determine if the student has met the standards and learning outcomes, therefore has passed the rotation. The formative evaluation summarizes the student's progress. Both the midterm and the final evaluation are somewhat summative. However, the midterm evaluation can offer the students a working plan to be successful going forward in the rotation. So now let's talk about the actual clinical evaluation paperwork. Most likely the policy manual of the nursing program is where you can see a specific example of a clinical evaluation. Hopefully you have a copy of the student's evaluation for your clinical rotation at the beginning or prior to the beginning of the rotation, because it's helpful for you to be extremely clear about the evaluative criteria before you begin. And as I mentioned earlier, ideally students should be aware of the evaluation at the beginning of the rotation too. So here are some general rules to follow. It becomes extremely important for the instructor to fully read the evaluation in order to complete it properly. I know that might sound a little silly, but I would see evaluations where instructors would not read the instructions carefully, subsequently would not complete it properly, and it becomes very difficult to support a student's passing or failing evaluation with weak documentation or a lack of specific examples to demonstrate the rating, especially should the student appeal their grade. Make note of where both the instructor and the student is to sign and date the evaluation. Remember, if it's not written down on the evaluation, it didn't happen and it's not complete or legal without signatures. Additionally, complete it correctly as to whether it is to have initials, check marks, or numbers. Each rotation in School of Nursing most likely has a different criteria for completing an evaluation. Some schools of nursing require a formative evaluation at the end of each clinical day. Others have a midterm and a final. For shorter rotations, maybe there is no time for a midterm. Anytime an evaluation is completed, refer to the school's guidance. I strongly recommend that you have a face-to-face with the student to discuss their progress, whether it be midterm, at the end of each clinical day, and of course most schools will require a face-to-face at the time of the final evaluation. The final evaluation should never be a surprise, pass or fail. And to comply with a student's due process rights, we must follow these guidelines. Students must be treated consistently. Communication is a must. Students need to be adequately notified about their academic performance. The students must be informed of any deficiencies that must be improved and the time frame to meet the expectations for improvement. The student earns their grade that you assigned. You are not giving them a grade. The pass-fail on the evaluation is their grade. Should a student be in a position of not passing a clinical rotation, they may not be allowed to continue in the nursing program. Therefore, at midterm or at the end of each clinical day, it is your opportunity, if you haven't already done so, to speak with the student to give them the specific guidelines on what they could do to improve their performance or behavior. Document the conversation. At the end of the rotation, you will have a face-to-face discussion with each student to discuss their final evaluation, as I mentioned. You should have documented the areas of concern. Once again, you address these items, as well as the entire evaluation during this final conference with the student. If you are concerned you may have to deliver a failing evaluation, I strongly encourage you to run this by your nursing school's administration, asking for guidance and the appropriate procedure that they wish for you to take. At a minimum, if your concerns are serious enough that the student could fail the clinical rotation, put them on a written improvement plan. Discuss daily written clinical goals in both a pre- and post-private conference with an evaluation of the specific daily goals each clinical day. There should be no surprises. For more strategies, read the article Strategies for Precepting the Unsafe Student, listed under the supplemental reading section. Some instructors feel completing the student evaluation to be one of the most challenging aspects of clinical teaching. In summary, it is important to decide on a strategy to record your daily observations and share them with each student promptly in a way in which they can continue to grow and improve. Most importantly, having a clearly defined criteria with examples will help you immensely. Study the student evaluation carefully to ensure that you are interpreting the outcome criteria appropriately. Mastering the art of the evaluation according to students is what makes an instructor the most effective. So how do you handle the student that's not passing? In the next video presentation, I will discuss the issue of clinical failure. Here are the references for this module as well as your additional resources. Thank you.